we have been forgotten or sometimes pushed aside by people on purpose. And to acknowledge that is very real.
Hi, I'm Dr. Keshishian. Welcome to our podcast series, House Calls with Dr. K. During this podcast series, we're going to talk about a lot of different things, but specifically it's about medicine, the human side of medicine. We all have questions about our health, and who can you turn to? The doctors that you trust.
Hi everyone, welcome to House Calls with Dr. K. I'm Talene Keshishian, and I'm joined by a wonderful group of panelists. Now, we just had a town hall yesterday, and we discussed the importance of Black History Month, and we were able to learn a lot about your own personal histories and experiences, and we want to thank you for that. Today on the podcast, we're going to dive a little bit deeper. So, are y'all ready? Okay, let's join our panelists here. So we're joined by Phillip Moore, our lovely co-host here and moderator. And then we have Dr. Malvin Anders from ophthalmology. We have Jackie Carter, registered nurse. We have Jamie Wells Robledo, registered nurse, and Kim Champagne from respiratory care. So thank you all for being here.
Thank you for having us.
Okay, so let's just tell us a little bit about yourselves. How long you've been with the county and what you do here at the hospital. We're going to start with you, Phil.
I'll start. Phillip Moore. I've been at LAC+USC only about almost 8 years, which is not a long time. Every time I talk with someone and they say, how long have you been here? And I said, almost 8 years. And they're like, oh no, you got some more time to go. I'm like, okay. So I've been here 8 years. I love it. I work for Brad Spilberg, the Chief Medical Officer, and Edgar Solis, and I manage the $170 million USC Medical School affiliation agreement for all of our physician services as my main job. And then my side jobs include, I'm the administrator for the Infection Control Department, the Clinical Social Work Department, the Psych Social Work Department, the Medical Staff Office, the IRB Research, the Trauma Program, and Grants Management here on campus. And so my fingers are all over the place, but I love helping people and helping the nurses and the physicians help deliver the care. Sometimes I think the administrator role gets confused or gets missed in terms of how they work in the healthcare system, because you always hear about the administrator, you always hear about the nurse, the tech, the physician, and other professionals, but you somehow forget, like, well, what is it that the administrator does, and how are they helping? And so I always like that role in supporting and delivering the health care that the people get. I'm not directly at the bedside, but if I don't negotiate with the lawyers to get the bed and the equipment for you to deliver the care, then the nurse and the doctor and the technicians can't deliver the care. So we're equal partners and equal players in this field, and I love it.
Thank you.
I'm Mal Anders. I'm an ophthalmologist here at County. I've been here at County in this particular stint about 13 years now. I trained across the street and did my internship here at County in the early 70s, a couple years ago. Spent some time away, did training down at actually Martin Luther King, which is another county hospital, and have been on teaching faculty there for a lot of years before coming here. My primary responsibilities here are clinical and supervising residents in surgery, as well as some aspects of the clinic, delivering care in the clinic as well. As with Phillip, I do have some administrative duties in trying to help keep the clinic running well, dealing with some of the supply issues in the operating room. Basically, fortunately, I have a new associate for the last couple of years, Dr. Wong, who's been able to take care of a lot of the chores as far as the clinic is concerned. So most of my activities now have to do with the surgery that we care for in the ophthalmic department.
My name is Jackie Carter. I've been a registered nurse here at LA County, USC. It will be 30 years in July.
Wow.
30 years in July. It's been a wild ride. I started out in pulmonary and went to med surg for a while, then went to pain management, then palliative care, and I am back at pain management, and I am the pain resource nurse for LAC+USC. and I love it. It gives me a chance to see all types of patients and actually feel like I'm making a difference. There's also administrative roles in there with auditing and policy and everything else. But the pain management and the patients, that's the focus, and that's what I love to do.
My name is Jamie Wills-Robledo. I've been with County now for 15 years. I started off as a student nurse worker at Rancho Los Amigos, and then I went on to be an RN on a orthodiabetic unit, and then that was for 9 years. And then I came here to LAC+USC. This will be my 3rd year, and I'm currently a supervising clinic nurse in the specialty clinics, and I do special projects. So current special projects are COVID testing and the COVID vaccine clinic. So I'm a supervisor for those areas. I love it here, right? That's all I can say about County is that actually my mom was the one who first turned in my student nurse application for County because she worked for County and my dad worked for the city. So she just turned it in for me and she said, here. And I realized in nursing school that this is where I wanted to work, that these were the patients I wanted to serve, that this is where I wanted to grow up as a nurse, because this is where I can grow, this is where I can make a difference, this is where I can help, and I love it here. And I think County has me. Like, I'm gonna be here for a while. I'm looking at Jackie and I'm like, me too, Jackie, I wanna be like that. So I really love working for County. I can't wait for, well, next 15 years, next 20 years, we'll see.
I'm Kim Champagne. I'm the pediatric respiratory therapist, respiratory care, and I've been here for 35 years. I've worked at Martin Luther King, Harvard, UCLA, Olive View, and I've traveled all around the county, and I love the county. I've been a supervisor here for like 32 years, pediatrics, and like you said, you've grown up here. I grew up here. I did work 5 years out of service before I came to the county, but when I saw the county, I was like, oh my God, and you could just transfer and you could just build. It was a lot of opportunities. And the patients, the staff members, and the administration's always been really good, patient and staff focused, and that's what I liked about it. And they always seem to value their employees. So, you know, I'm actually retiring in April.
Oh my
goodness. And it is bittersweet, but we must go on and retire when it is our time. Yeah. So, but yeah, this is a great place to work.
Wow. Well, congratulations to you. And thank you, everybody, for all of your service. Our patients, our colleagues, everybody appreciates everything that you do. Wow. That was unexpected news. I knew we were going to get deep, but I didn't know we were going to get that. Wow. Okay, here we go. You know, in preparing for this podcast, I did a lot of research online. And there are interesting questions that come up when you type in Black History Month. Are you guys interested to hear what they were?
Sure.
All right. Yes. One of the common questions that comes up is, what is most acceptable, Black or African American? It comes up. It does.
In preparation for this, I was in the clinic today, and I had nurses, and we were talking about it. They're like, what do you do? They said Jamie will be away for a little bit, and they were like, Jamie, what are you doing today? And I said, we're going to be having a panel, and we're going to be discussing things. And then it came out very unnaturally when I said African American Heritage Month. I was like, whoa, I was like, Black History Month, right? And I've been reading things, and it says, we have to know, Black is not a bad word. And I've heard it whispered, and I've heard it, oh, you're Black, or you're African American, right? Am I African American? Yes. Do I know if I came from Africa? No, I don't know. My dad does not know his origin from Mississippi and where his mom's mom or everything from that came from. But Black is not a bad word. It's a culture. It's who we are. I am Black. I don't think it's bad. Does everyone else feel that?
I have the same feelings in that I think just like we as a people have progressed from the early 1900s to current, even the way that we refer to ourselves or what we do and what we call ourselves has progressed. Because even in the early 1900s, you look at literature and things, we refer to ourselves as Negro. And then from Negro, we then developed to Black, because then in that 50s and 60s, we needed that extra pride, and we were getting that pride. And then as you get into the 80s, it's like, okay, well, we did come from Africa. Now, we didn't come from Africa this last generation, but 200-300 years ago we were. And so I think there was a time period where we wanted to know, okay, well, we have roots because everyone else has a root word of where they came from. We came from Africa. Now, I haven't been there, and like Jamie says, we may not know the tribe that we actually came from. For some blacks that were here a while, but it just shows that progression, and it is difference, because if you speak to other backgrounds that come from their first generation from Cameroon, Nigeria, or Haiti, Jamaica, wherever, they will refer to us as more American than African American, and they'll look at you and say like, okay, but you don't even know what tribe you came from. The culture, the value, the food, the music, some of that is still present with us in different forms, but the core traditional music, value, foods and stuff is not there because it's been a couple of hundred years removed. And so it is a difference, and it is a good dialogue and a good discussion, because some people have an issue with where you're more American than you are African. But I come from Africa, and it doesn't matter that I've been in America for several hundred years. I still came from Africa, and most other ethnic groups refer to their country of origin. And so it is, you do get mixed emotions and mixed feelings among blacks and among non-minorities that say like, well, what should I call you? Is it black? Is it Negro? Is it, I mean, what's comfortable? And so it just really depends on the setting and the generation, because if you speak into certain generation or groups, they will refer to themselves in certain manners. And you speak to more younger generations like, well, I'm African American. But if you grew up like Jamie's father in the 50s and 60s, it's like, this is black power, I'm black pride, I'm black. And that none of that is diminished when you refer to yourself as an African American or anything else. But for him, it's like, this is what was all around me, black power, black pride, and that's what I grew up with. So that's what he may be comfortable with.
And with each one, it's an enormous amount of pride to say that I'm African American, to say I'm black, because like you said, in the 70s, 60s, we were like going that way. But each designation has a lot of pride with it.
Thank you for that.
And also, we have to remember that not all black people in America are African or African American.
That's correct.
There are people who are black who are from the Caribbean, from Cuba, from Puerto Rico. Like, we come from multiple areas. If you look over the continent, there are black people, right? But we are in America, so like you said, to hyphenate or to say where we came from plus American, right? But for me, yeah, I say black.
Yeah, so do I.
I do as well, but I share some of the concerns Phillip mentioned about really knowing something about the origin. If we have skin this color long ago, so we had some relative that came from Africa, probably, but not necessarily, and we don't really know that. I think either one could be acceptable as long as it's respectful.
Yes.
But quite honestly, that's another thing I'm angry about. Why do we need to think about it?
Right.
Should be intuitive.
Yes.
Sure, absolutely. Now, we are talking about Black History Month or African American Heritage Month, and I wonder, when you hear those terms, what does that make you feel? What do you think about?
That you are like Dr. Andrews said, that you are designating me as this person, as a race, as opposed to just a person. Just like, if they're not saying it about anybody else, then why are they saying it about us, designating us as African American or black? Just, if everybody's at the table, just everybody's a person. To designate that, I mean, for us, it's nothing bad, but It's just that, why are you saying that? You know, that's when I started thinking that I'm like, okay.
Yeah.
Yeah.
I think that it gets back to respecting people as human beings. And yeah, you have a certain appearance, but you know, as long as you're sincere in what you're doing, and hopefully in medicine you're good at what you're doing, none of that matters.
I hear Black History Month, and to get, you know, in the nitty gritty of it, people are like, why do you get a month? Right?
Yeah.
I think, you know, and I've heard it before. It's not an uncommon question. And I think it resonates with when we say Black Lives Matter. And it's saying that sometimes we were not seen, we were not heard, that our history was not told, and that it needs to be integrated into current knowledge, right? And that we have been forgotten or sometimes pushed aside by people on purpose. And to acknowledge that is very real, and to move forward to acknowledge it and know that it is part of it, and that hopefully one day that we won't have to have a Black History Month, right? That it will be just common knowledge that this is what happened. But for now, we know that it was put aside and sometimes swept under the rug, and or someone else claimed to fame by on the backs of us, right? So that needs to be common knowledge, and that's why. And I think all of us have also heard with Black Lives Matter, we're not saying that you don't get a month or that you don't matter. We're saying that in other people's eyes, in the current way we live, it looks like we don't matter.
And that gets back to Dr. Woodson's early beginnings in starting his movements. If he could have progressed in his specialty, which was history, as a Black man like anybody else, we wouldn't be having this conversation.
Right.
Very true.
And I like to think that we take this month, since it is designated to us, take this month to learn more.
Yeah.
To learn more.
I agree.
There is so much more to learn.
Yes.
And every opportunity that we can have, we need to take it. And maybe one day soon, there will be no Black History Month. It's just every month.
All the time. It's history.
It's history.
And certain books need to be rewritten.
Oh,
Yes.
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 Because there are so many things that are missing from the history books that you do have this month of recognition and celebration and humility and humbleness of what our culture brings to the table, and the milestones and everything that has happened as a result of what we brought to the table. And so it doesn't mean to discount anybody else or anyone else's contributions, because America is really the great melting pot. When you really look at like, well, who were the original people that were here in America, it's like, okay, it was the Native Americans. And every other European, Eastern European, African, everybody else came here. And so to then claim like, well, who is supposed to be here? Everyone's here. Everyone is supposed to be here. And recognition of all of those accomplishments. Because like Dr. Anders and Jackie said, you read in certain history books and it's like you'll read gaps and gaps of accomplishments and they're just missing, and it's like, well, did we not do anything? Where did we do? I mean, so it does raise that question, and I think that month just highlights that this is what we need to do. And to Jackie's point, hopefully, and to Jamie's point, in a couple of years, maybe when Jamie's son grows up, maybe we may not have to have a month. Because at that point, it's integrated and everyone's well aware the human rights aspect is addressed. And so you're addressing the human rights of every ethnic group and every minority and every even majority that's made contributions to this great country.
Well, so well said. Thank you.
Yes.
You know, we're all in healthcare. Actually, before we get to that, I really wanted to know, since we're talking about spirit of celebration and education, Jackie, I think you have some educating for us, right? You have some notable contributions at LAC+USC that you might want to be able to highlight for us.
The first African-American nurse that graduated actually from a county was Adelaide Magruder, 1922. Wow. So from then on, there were African American nurses. And when I was reading the history, it was very interesting because it said that if you had let's say 6 African American nurses, there was a limit, an unspoken limit. I was reading this in the county history.
Wow.
There was an unspoken limit, and you knew that 2 or 3 would be gone.
Wow.
Was the limit in terms of how many that they would be willing to hire, or
How many they'd be willing to
enroll?
graduate.
Oh, to graduate. Oh,
To
so then that
graduate.
means some of the people they, by design, were going to fail
Fail.
them out.
Yes.
Yeah.
That was the implication. And
okay.
this was coming from, these are histories from the nurses that were actually going through this at the time.
Yes.
Yes.
The
So,
lived experience.
yes, lived
Yeah.
experiences. So they also talked about having the separate quarters here
Yes.
in the cottage F, I believe,
Yes.
up until 1950s when they decided to integrate. Now, 1950 sounds way back, but it's really
It's
not
not
that
that
far
far.
back.
It's not that far
That's
back.
70 years ago,
Yeah.
people. That's, to this day, there are still things. So anyway, I just wanted to also just bring up and just thank the nursing clinical directors that paved the way for us to be here. Corrine Fields for surgical services, Betty Mosley for medical, Sarah McKinney for psychiatric services, Ms. Decatur for perioperative services. So she is,
She's a legend.
she's a legend, but she's
legend, and
amazing.
she's still here.
And the
amazing.
respect that she commands
Agreed.
is amazing. When Miss Decatur talks, we go quiet
Yes.
because
Yeah, you listen.
she does not say unless she doesn't talk unless she needs you to hear her.
Yes.
That's true.
And it's not about that she's been here for a while. It's about that she is that good.
Yes.
Right.
She is that good.
And she cares, and she's just undying and unrelenting and unwavering for those patients.
Yes.
If she feels we need to do something for a patient,
Yes.
like you said, you will hear from her.
Yes.
If she feels that what we're not doing is appropriate for that patient, she's going to bring us up, and she's going to make us go in that right direction to meet the need for that patient.
I remember
That's what it's
having a
about.
conversation, and I was a little young and naive, and I'm like, oh, well, the doctor said to do this, and she's like, Jackie, and I just, yes, Mr. Cater. Is that the way we're supposed to do it? What is policy? What is in the best interest? Da, 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 da. As not mean, just straightforward, really in a gentle voice, just corrected me.
Yes.
And I was thrilled.
Yes.
I was thrilled because it made life so much easier when you have somebody who's been here, knows it,
Yes.
and can lead you on the right path.
Yes.
So for that, I really thank her.
Living legends.
Yes.
She deals with facts.
Yes. And then Department of Emergency Medicine, Gail Higgins and Velda Carter, who recently retired. So
Yes.
again, they just did an amazing job for us to be here today.
Thank you, Jackie. Thank
You're welcome.
you for sharing that. Thank you. And thank you for all those people that you mentioned and their contributions.
Yes.
Now, we have been talking a lot about race relations. We talked about it in the town hall. How do you think race relations have affected healthcare or the way that you practice medicine?
I
tough,
think they have
yeah.
gotten, how can I say? I think there's been a greater level of respect between different races or different ethnicities. And that goes a long way. As far as actually practicing medicine is concerned, I know that from my childhood and really probably close to the time when I went away to college and was thinking about going to medical school eventually, all the doctors that my family ever saw were black. And there might have been a variety of reasons for that, but up until that point, or at that point, I thought, they were, if you were white, you were supposed to see a white doctor. If you're black, you're supposed to see a black doctor.
Oh, okay.
But obviously that has changed. But one of the things I think has changed that is the overall acceptance that black people could become doctors or nurses or whatever. there were times when you could only do certain jobs. And one graphic example of that in my own life, my father did a lot of things as he supported his family growing up. At some point in time, he decided he wanted to be an electrician, which he ultimately was. But he was blackballed time and time again, not because he didn't know how to do the job and do the study that took to get certified and so forth, but unions would not allow a black electrician.
Yes.
He eventually overcame that, and that's one of the things that encouraged me to not worry about that. Just do the job and prove your worth. So I think it has to do with accepting that anybody can do anything. And that's one of the things that we were taught, and I taught my children: be what you want to be, just do the work and get there.
When I thought about becoming a nurse, I went to a nursing school. It wasn't county, by the way. I went to a nursing school. I think I need to clarify that real quick. And I went to see the counselor, and I said, yes, I want to go into the RN program. And he's like, well, I really don't think you're qualified. Had not looked at my records, had nothing to go on besides the fact that I walked in the door. And I said, no, I want to. He goes, well, why don't you look at maybe doing this or doing that? But I don't think you're a registered nurse material. It takes a lot of study. It takes a lot of classes. It takes a lot of things to do this. And again, my parents raised me right. And I just said, I look at my records, and do I qualify to get into the school? I was a professional student. Yeah.
Attendance mattered.
Attendance mattered, and literally it was like my parents were wondering if I was ever going to settle down and do anything because I had been in school for a while. So he looked at my records, and then looked at me, and then looked at my records again, and says, oh, when do you want to start? I had finished all the prereqs. I just needed to get in. And I said, when is the next class? He goes, in fall, and then I'm in fall.
Wow.
But to say that, and it could have easily just knocked me down. Oh, I don't think you're RN material. That, I mean, my parents raised me to be a strong black female, not to be deterred by anything anybody says. If I know I can do it and I want to do it, then it will happen. But it made me wonder how many doors were closed for other people.
Yeah, exactly.
It made me wonder how many doors were
It
closed
breaks
for
your
other people.
spirit.
Yes.
Because in those instances where you had the infrastructure in the background and the confidence to stand up to that and do that, that was fine.
But
some of us may not have had
exactly
that background, and some of us may have come from broken homes, and maybe we're the first ones that were going to go to college, go to nurse school, go to medical school. And you're right, some of us may not have been that resilient because they just didn't have the emotional intelligence to withstand when somebody is blatantly telling you, I don't think you're qualified, I don't think you'll be able to go, I think it may be too hard, without even evaluating do your education and your background and your support, can you get through this program?
Yeah.
And so those are some of the systemic glass ceiling type things that we see that still need to be broken and shattered as we progress.
Absolutely.
Race relations in healthcare are really important, right?
Yes.
Because the people we care for are looking us like almost like in a mirror, right? This person needs care, right? You need to be healthy too, and I need to be healthy. How can I care for you, right? So do they see people that represent who they are with their same common goals in their lives, right? To ensure that the people that we're serving look like us and we look like the people we're serving, right? To see that and correlate is to have that trust, right? And to come together to know that here in our facility, health is our wealth, right? What we want to do, not to make money, but to see people survive, right?
Yes.
So I think it's important that we have healthcare workers, nurses, doctors, providers, respiratory care therapists, administrators who are multicultural, like we were talking about in the town hall, so that we can serve properly, that we are servant workers, basically, to serve everyone. But we have to look within our systems. Is there born-in systemic racism, right, that affect the life expectancy of people who are Black, who are minority, who are all these things? And to see, because it does, I told my clinic today, our encounters with our patients during a clinic visit can literally dictate if they come back for another clinic visit.
Yes, true. Yes.
Our smile, our welcome, our this, you don't know that when you just, next, you, what, right? They are deterred to come back to the hospital, period.
Right.
That's the way they treat me. That I'm not going to go back, of course not. That your warm smile, your warm eyes behind the mask make a difference. And that you can be encouraging that next person who normally does not come to the hospital to come back again and get the care that they need. Because I even read that racism can literally make people sick. And that's in the way that prejudices are being sustained.
Right.
Against Black people, against minorities, against people like this. And it can literally cause sickness, right? If you do not seek care within our healthcare facility. That it is literally killing us. That other people who find goodness in where they get their healthcare treatment because they look like the people who are treating them survive, whereas I'm not coming there because of the implicit bias or microaggressions that may occur. So we need to be very knowledgeable of that so that we can give proper care and that we could see people survive. And I think that's really, really important in our healthcare.
I personally haven't had any obstacles here. I think just because it was a county system, everything you put in your application, and for the most part you are judged, by your accomplishments, your degrees or whatever. And I just haven't, I was looking at that question and I haven't had any problem. I don't know, but I have seen people that say they have a problem, but I just haven't had a problem.
But I think that just demonstrates that there has been progress, because some people think that we haven't progressed, that the world hasn't changed quick enough, and it's like, there's still more work to do, but there has been some progress.
Yes.
We do have some rights, we do have some recognition. People are recognizing, it's like, okay, I'm gonna pick the best person, and if that best person happens to be a female, I don't have an issue with that. If that best person happens to be a person of color, I don't have an issue with that.
Exactly.
It's your qualities, and so that progress is there. So the fact that you have not had that experience, and some people have, says, okay, we're getting there.
Yeah.
We're getting there slowly, but
Absolutely.
it's getting there.
And I could definitely see that in the county work.
Yes.
Definitely, right? With the staff that we see that are working here and the care that we give to our communities, right? And then once you mention the hire process, it is very fair, right? And then we have our just culture within our facility as well to make sure that things are just, right? And we have we
even have avenues when we think it is unfair. For if
That's
we
true.
think it's unfair.
Yes, exactly.
For outside agencies to come in and look at it and say,
Exactly.
it might have been your perception, or
Yes.
maybe it was. Who
Yes.
knows? But we have avenues to address those issues,
And that's
we
the
need to
beauty.
use them.
Right.
If you think
Yes.
if you think it's an issue, then we need to use them.
Yes, we have systems in place to
Place.
help with these things. And that is the progress,
is.
Right.
right?
Yes.
It is the progress.
Yes.
And the progress continues to further look at these systems, practices, policies, and to see and ensure that they are doing these things, to make it our goal to make sure equity and inclusion is always at the top of our goal.
To be at the table when the policies are written, so we can
That's
make
Exactly.
sure there's no implicit biases.
Exactly.
Right.
Even if somebody obviously doesn't even recognize it. No.
Yes.
Just
You-
know.
Yeah.
Another thing that we also have at the county is I'm not sure of the exact title, sorry, but where patients are on the panels and meeting in these
Yes.
things as
Uh-huh.
well, that we
Yeah.
are pulling from the community. And when these policies, practices are made, the community, the patients actually have a voice when
Yeah.
we're here.
Absolutely.
Not
Yeah.
only providers,
Right.
that we are hearing the patient experience in this. Okay,
Yeah, that-
and I think that is also such progress that we are amplifying the voices of our patients and of our employees, and that there are means and transport and ways to ensure that those things are happening. And I think that's what we all love about
Absolutely.
county.
Yes.
Yeah. Claudia Mata spearheads that patient engagement community.
Yes,
Yes.
thank you,
Okay.
thank you.
Claudia Mata spearheads that, and it is good. We had to stop it due to COVID.
Yes.
But yeah, it is that direct feedback where we think we may be delivering good care, but it's like, but you never asked the patient.
Right.
So they bring patients onto the committee, and it's like, well, how can we do better?
Yes.
Can you find your way around the facility? How did the doctor treat you? How did the nurse treat
Yes.
you?
I've
Are
actually
there
had
certain things that need to be done?
Sorry, Phillip. I actually
Yeah.
had a couple of patients that wanted to come back.
Mhm.
But again, it's during COVID. But we gave them contact numbers so that when it is,
Over.
more calm, they can reach out and come back. Because one patient's like, I've been to your ER so many times, and there are so many things you guys do right. There are a couple of things you guys could do better. I'm willing to help you.
Mhm.
I was like, thank you.
Yes.
Yeah.
I know, because we're not perfect. We
Mhm.
all know that, guys. We're
Mhm.
not perfect. And there are days and there are days. So if we can do better and you're willing to help us do better and see it from your point of view,
Right.
we are open.
And the fact that now even people of color feel empowered to independently call you and say, hey, I can offer some help to your organization. I mean, several years ago, a long time ago, Latinos and blacks and females were treated differently. You come to the hospital, you may get thrown through the back door and you may not even get any care. So now, fast forward 100 years, and now you're invited to help us deliver that care, because now the healthcare community has now realized the patient is a partner in the care.
Yes.
We deliver the care, but it is ultimately the patient. And so we have to have that collaboration.
Yes.
It's not just, well, the doctor says you need to do it and the nurse says you need to do it, and the administrator is not going to pay for it because he doesn't want to. No, it's a partnership, and hearing directly from those patients allows us to do better, because we may think that we're doing perfectly fine, that we've got the best
Right.
delivery system, we've got the best communication system, we've got the best telephone system, until the patient says, I don't think so.
Not
That's
quite.
not that good. But here's
We can
how you
work
can
on
help.
it.
Yes.
We can work
Yes,
on
we
that.
can work on it.
Exactly.
What's really rewarding is the chimes.
Oh, for
Oh,
the COVID?
for the COVID chimes,
Oh,
yes.
yes.
I love
Do you know that where that came out of?
Where?
That H3 team
It
that Jamie
did.
was talking about.
H3
God.
meeting.
So,
yes,
so
yes.
shout out to Dr. Lou
Yes.
Yes.
and
Yes.
Sonny
Yes.
and that
Very
whole
good.
H3 team. That again, they went around talking to people, getting that feedback, and it's like, you know what? The doctors, the nurses, the techs are saying, this is something that we need to recognize. We have a sad face when we have a patient that expires, which we all do, which I think people that are in non-healthcare think it's so odd that healthcare professionals have an issue when somebody dies. It's like, well, you guys see that all day long. You guys should be normalized to it. It's like, no, we're not normalized to it.
And we should
We-
never be.
Right, and we aren't. And so when they then started the chime, every time we discharge a COVID positive patient that's able to go home, that is a celebration, because not everybody is dying. So
You
they
should hear it on
started
the
that
wards.
chime.
I mean,
Oh,
I'm
yeah.
hearing the shouts and the cheers
Oh,
yeah.
and the
everybody's so
clapping.
excited.
It is
Yes.
so nice.
It is good.
Okay,
So
so
nice.
Dr. Lou, I hope you're listening, and our HT members. Just for the listeners, we have a whole podcast with Dr. Lou and talking about H3, so please tune in if you haven't listened to that episode. It's really important that we take care not only of our patients, but of one another during this
Yes.
difficult
Yeah.
time. Absolutely. Absolutely. It sounds like, yes, we still have work to do, but there are positives
Oh,
and things that we have done right.
Right.
Would you all be willing to share a memory or a time where you felt like I was celebrated for who I was or what I contributed?
You know what, I think the bottom line, while we have a moment of silence,
So many different ways.
right, it's a difficult, I think sometimes it's hard for just people in general to step back, and essentially what you're asking is, explain the time where you did good and you patted yourself on the back and somebody said that was excellent and whatever.
Exactly.
It's hard because sometimes it's like where everybody, well, this wasn't done right, or you complain about this, or you complain about that, or, oh, well, you did this, but it wasn't quite up to par. And to sit back and say, okay, well, what is something that you can think of that was like excellent and you were rewarded for it? You have to like, okay, well, let me
Right.
that.
Well, I have one last one.
Because
I have
sometimes the compliments may not come as fast and as furious as they should.
Right.
Or
as well
about
as
the
the
things that
complaints.
you think they should come about.
Right, right.
I had one. I had a patient, and the patient was very ill. And I was overseeing with my RCP. Just I go and look at every patient, and I'm looking, and so the father asked a question, and my RCP, they did explain, and then I went further, and I explained it even further, and 2 steps further, because I'm looking at him, and I wanted him to understand. He says, "Thank you." He says, "You made me feel good. You made it," because I could see, and I know when I'm getting to them, and when I had him, and he understood, and he told me that, I said, okay.
But that just shows that you're really attuned to your patients, that
Yeah.
after your team explained it, something in your inner body was like,
Right.
I don't think he fully understood,
that.
so let me explain it another way or
Right.
another couple of ways.
Until
And
he got
sometimes
it.
it may take several times, but it is that good feeling that it's like, okay, I've reached
Reach
the
someone
person.
and made him feel comfortable and not afraid, because just 3 months ago, we couldn't even have family members in there.
Yeah.
Right.
And then, so it's really good to be able to address that to them, any care to them.
Do you know where that question comes from, the one that I just asked?
Oh, no.
A resident of mine, my chief resident 2 years ago, said we spend so much time complaining about the things that we don't like, and we're so hard on ourselves all the time that we don't take the time to celebrate the things that we did do well. And so he came up with this idea of having roses and thorns, where you have the opportunity to talk about the thorn,
Yes.
but please mention a rose.
Yes.
Right.
Right.
And so that's why I bring this up, because we do have a long way to go. We
Mm.
still do. We're not there quite yet. But I wonder if we can talk about some of the roses.
The vaccine.
I was just,
Oh,
about
the
to.
Vaccines. I mean,
So
go ahead, Jamie.
The vaccine. Actually, let's go back further, Phillip, to when I met Phillip. Actually.
Oh, that was a
Oh,
rose.
okay.
Well,
Okay.
I've always seen
Okay.
Phillip. I've always seen Phillip, and I was like, I like what he wears. Anyway, beyond that, we were tasked, or actually, my boss said, Jamie, we need you to go out and help in the community. And I was like, ooh, what are we doing? What are we doing? And he said, we're going to start testing for COVID. And we've been asked by the supervisors, Hilda Solis, to take over one of the testing sites. And that was in the beginning of COVID, right? Or not beginning, maybe like mid-COVID. I don't even know where mid-COVID is. But anyway.
Somewhere in the past year.
Yes. He said, Jamie, please teach the nurses how to do swabbing, because we were doing it here already, and bring it to the community. And I remember me and Phillip, we went to the city of Bell, and they taught us in a mere hours what they were currently doing at the spot for testing. And in mere hours, we were expected to deliver. And we did, right, Phillip?
Yes, we did.
And
Yeah.
we brought testing, and we were able to take on the system, take on whatever they were doing, and continue testing the city of Bell. And what was beautiful about it, I remember, Phillip, in fact, you probably remember, they were like, you only have 100 a day. And me and Phillip were like, that's not county.
That's not
Right,
gonna
that's
work.
not
That's
county.
not county.
No.
That sounds like a limitation.
Right.
And that sounds like we can't serve everyone who needs to
Right,
be
right.
served, and that's not county.
Right.
And I told Phillip, I was like, how do we get more? He's like, we're getting more. And I could tell you, they were like, we're not going to take walk-ins. I was like, but walk-ins are the ones who need it. And Phillip was like, yes.
Yeah.
Phillip found more through his work, and we were able to accommodate more. I tell you, we were there for what, 2 weeks, Philip? By the first day,
about 3 weeks. About
3 weeks, right?
Okay.
The first day we had about 60.
Mm-hmm.
The last day we had about 300 to 400 people
300.
come
Yeah.
to get tested. And that was because we were taking walk-ins and that you didn't need access to your phone or computer to get tested.
Right.
We found the ways and the means to have our computers out there to register patients right then and there and get tested and have the supplies we needed from county to ensure that people were tested.
Yeah.
Were we getting positives? Yes. And
Yeah.
people were finding out how they could protect themselves from COVID in their own community. And I think, right, Philip, that was one of our really great points.
Yeah.
And it was hard. It was on, I want to say 4 out of the 5 days, over 100 degrees in that parking lot where we were
Yeah.
doing
Wow.
testing.
Wow.
We had nurses out there in full PPE,
Oh,
gown, mask, gloves, head, face shield, everything, and we were able to deliver the care. And they
Yeah.
were, county was so great or amazing with us to give us lunch, to give us water,
Yeah.
and to ensure that we had the staffing so that we could serve our patients.
Yeah.
And I think that was really great. It was so great to see.
Yeah.
And on top of that, that translates into vaccinations, right? We were able to pop up a vaccination site in like a week.
Oh,
With
it
the
was
help of, right?
less than a week, because we got notified. Jorge notified me that Thursday. We were trying to do a transition with the other old partner that Friday. We had to go live that Monday or Tuesday.
Right.
And so we really did pull it together. I mean, they didn't, I don't think they realized when they put me and Jamie as co-pilots on this particular project, because like she mentioned, they were a little bit upset because we were like, okay, you have 60 test kits. And on the first day, me and Jamie just looked at each other like, okay, we're doing more than 60, but how do I do it? I said, I'm the administrator, I'll figure it out.
Exactly.
I called them and I was like, well, we need more test kits. Well, you're only allowed a certain number of test kits. We need more test kits.
Yes.
And we need, so I'm like, Jamie, what else do we need? Well, Philip, we need this. I'll
Yeah.
take care of it. And so you need that tag team.
Yes.
And then they were like, well, we just want to ask you guys only do drive up. So I went to Jamie, she's like, Philip, people are coming up on bicycles and walking. I said, okay, then we're going to take bicycle and walking
Yeah.
as long as you can do it safe. We can. And they were like, well, all the other sites are only doing 60, 70. How are you guys getting like, by the end of the week, Jamie and her team were up to 160, 190. I mean, it just went up higher and higher each month when that site was only supposed to do 60 per day. And we're like, the need is out there. The need is there. And then even with another Rose good thing is, even when the first day that we got there, there was supposed to be a demonstration, and that was in the early part of the demonstration. So while Jamie and the team and the facilities guys, the nurses, the techs, the clerks, everyone's setting up, the Bell Police Department drive by and they're like, what are you guys doing here? And me and Jay we're getting ready to set up a COVID clinic. It's like, well, you know there's supposed to be a demonstration. I'm like, well, where is it at? They're like, right in this area at that corner.
That corner right there.
Which is, we're in the parking lot of the corner.
Yes.
So we looked at each other and I called Jorge and called Edgar Solis and I'm like, well, what should we do? She's like, he said he's gonna come back to see if he can get some more intelligence if the demonstration is going to come on. So they came back and they said, well, we think it's not. So it's like, okay, they're not, we're gonna go ahead and set up.
Yes.
And we were inclined, me and Jamie were so crazy, we were inclined to set up and like, we'll just leave when the demonstration starts.
Yeah.
Because we need to get some people vaccinated.
Yes.
So it's
Just
very,
go around, boom.
right. So you don't put us in charge of anything because we'll go into a landmine and get some services done.
Wow.
Yes. So that to me was,
It was good.
it was beautiful to see when we had, it was purely word of mouth. You could tell that they were like, go to this county site, they will get you tested, they will ensure that they do it right.
Mhm.
And that was amazing.
I mean,
and to meet Philip in that was like great. And
Because that was the first time that I'd seen her, but we hadn't worked on a project together.
Yes.
And so it was good. And then she got to see like how an administrator really is supposed to get things done.
Yeah.
And when they tell you, no, we can't do it, that the administrator figures out legally how are we going to get it done. And Jamie, any resource, you're like, okay, I'll get it done. I'll figure it out. But that's my role. And that's her role, that you identify what do you need to take care of these patients. I'll get you everything you need to take care of these patients.
And it's so outside of what we were currently doing.
Right.
So we have never been, take care of patients outside, right?
Right.
During a
drive up.
demonstration.
During a
Right,
demonstration.
during a
Like,
demonstration.
how do you
And
get training for that?
That was real. That
Right.
was
The
really
computers.
real because it was in the height of George
It was
Floyd.
in the early part
Yes.
where
Like,
all the law
right
enforcement
when-
agencies were
and
there.
and for the police to come to us and say it's gonna happen on this corner, I told Philip, I was like, Philip, are we going to join the demonstration or are we going to be testing?
Right.
Right? And like you question what we're going to do, but we know that our loyalties lie in both, right? In racial justice and for testing. And that is
Yeah.
why we had to move forward with testing.
Right.
You know what I mean? That we're not going to stop because of the demonstrations. We
Right.
need to continue to test our community and make sure that we're safe health-wise. Also,
Wow.
in the way that people, if they need to demonstrate,
Go ahead and
also
demonstrate.
that.
But at that time, especially, they were starting to notice that some of the testing sites did not have enough sites in the community.
Yes.
And in that Bell community, the Latino community where we set up, they did not have. So it's like, you need access to services just like everybody else.
Absolutely.
And so they were like, okay, we're here, we're going to get it done. We weren't turning anyone away.
Oh,
Sounds like you are the embodiment of what we achieve to be here at County.
yes,
Yes.
yes.
They
That's
always
why
say
we're
if
all
you work
here.
at county, you can work anywhere.
Oh,
But
yes.
that's
Yes.
the thing.
Yes.
Yeah.
There's 8,000 employees here that do exactly what Jamie and I do
Agreed.
all day, every day. I mean,
Agreed.
it is truly a team effort, and so it's joy because the facilities management people were doing backflips getting things to us.
Yes.
Sean was doing backflips, making sure we had the nursing services,
Yes.
supply chain operations. Their team were doing backflips, making sure that we had the supplies that we needed. Everybody was bending over backwards, but that's what we do in the county.
Yes.
Yes.
And that's
Yeah.
what people, I think, don't understand. And even when you say the roles aspect of it, county employees don't really brag a lot about what we do. I mean, there's so much research, innovation, cutting edge things that are done in county. And we look at the news and we see the publications and we see things and it's like everyone else take credit, but it's like, that started at the county. We don't brag on ourselves, of which, like you said, we need to do better about, but we just don't, because I'm not in it to then get any recognition or bragging rights. I want to do it because it's the right thing to do. I want to do it because somebody out there needs that service, and somebody that was before me didn't get that service.
Right.
And so I have to do my job, as well as the other 7,999 people here are doing their job. Like, hey, we're going to have access. We're going to make sure people get what they need, because a few years ago, some of those populations did not have that.
Absolutely. We as county employees are also diverse and come from so many different backgrounds, and that is who we serve, a
Yes.
diverse patient population.
And we wouldn't have it any other way.
Right.
That's right. Absolutely.
Wouldn't have it any other way.
What a wonderful story. Thank you guys for
That was
sharing.
great.
That was great. So as we wrap up, I have a little fun question, okay? And the question here is, we've talked about the world, we've talked about politics, we've talked about, healthcare, and the world has changed so much from what maybe your parents' generation had seen to what you're seeing, what your kids might be seeing. What do you think that you might say, if you could think back to your teenage self? I know it was yesterday, not that long ago. But if you think back to your teenage self, what do you think is the one thing that you would say to yourself?
I would just tell myself sometimes have patience, because sometimes I want to get certain things done because it is taken too long. And if it's taken too long, and I try to put myself in the position of the patient. If I'm the patient calling and I have a problem and there's something that needs to get done, and I give them an answer or a response or whatever, would I be satisfied if I told you it's going to take me 2 weeks, if I told you it's going to take me 3 weeks, or if I told you it's going to take me 2 hours, and realistically, I can get it done in 5 minutes, but you're calling me on lunch, and so I'm going to have you wait. I do that as like an internal check and balance for myself. I'm like, would I like that?
Right.
And if I wouldn't like it, then I'm sure that patient or the organization that I'm working with, or Jamie, the nurses, Brad, Jorge, Edgar, whoever, Annie, whoever I'm working with, if I don't like it, then they probably won't either. And so I use that to then keep myself balanced in terms of like, get it done, make it happen.
Patience. I like that.
Patience.
Patience.
I think I would have told myself that it's going to be okay. I probably did not have an idea of what I was going to do as a teenage self. I was going to write my bestseller. I'm still working on that. I was going to write my bestseller. But I did not know, I had no idea, seriously, that I would be a nurse.
Despite the long family line
Right.
of nurses.
Probably because of the long family line of nurses.
There's a reason not to do it.
My mom was a vet, so you know that structure. So probably not going into nursing was probably my goal. Not going into nursing was my goal, but to get here and then be good at it. It's rare when I don't say that a lot, but I'm good at it.
Yes, you are, Jackie.
I'm good at
There
it,
you go.
and I really like my patients. And I love when they get there. We had a patient yesterday that had to think of the process through. This is somebody in pain, but they're going home, and they're not going home on the same amount of medication that they have here, and had to go through the process. And he goes, but I need it, but I need it, but I need it. And listening, the one thing that the world needs so much more of, listening. And just listening to him. Every once in a while, injecting, but listening. And he got there all by himself. He goes, I'm there. And I'm like, that's so awesome. So when I saw him this morning, he was like, I'm good.
Nice.
And I'm like, thank you. That's all I want. It's for you to be good.
Great.
That's
good
what
advice.
Yeah.
I would tell my high school self, be you. Because I think there's so many different people, things, everything around you telling you who to be and what they expect you to be, or to fit in some type of box, or, be this way. That to be you, say what you say, be who you are, feel what you feel, and continue that. And you may have doubt, but continue to be true to who you are. Yeah, that's what I would tell myself.
Amazing.
I would tell myself, you can do it. Because every time I faced a hurdle, I didn't know if I could do it. And they said, oh, do this and that. I did it. And I was like, that was so amazing. And to this day, anytime something's difficult, so I got through respiratory therapy school. I can do anything. And I always judge things by how hard that was.
Right.
And this is piece of cake. So yeah, we do so much, and our job is so hard, and even plumbing at my house. I make T-tubes all the time. That's nothing. My husband's looking at me like, what? But we do a lot here.
Yeah.
And we don't even think about it, but it's really complicated stuff, and it translates out into the world.
Yeah.
And thank you all for listening. Please join us weekly for all of our episodes.
Thank you.
Thank you.
for having us.
Thank you for tuning in today. Make sure to follow us on Instagram and Twitter, and to subscribe to the LAC+USC Medical Center YouTube channel, where you can find all of our previous episodes, in addition to the episodes located on anchor.fm/House Calls with Dr. K. We also want to hear from you, so email us at lacuscpio@dhs.lacounty.gov. Thank you for tuning in, and see you next week.